Hey there! Before you're about to dive into one of the episodes for our maternal mental health series, make sure that you have subscribed to our podcast on Spotify, Apple Podcasts, or wherever you get your podcasts. If you like this episode, we would appreciate if you spread the word and recommend or even forward this episode or the whole podcast in general to another parent or to anyone who you think should be listening to this. If you find yourself asking how you can support us, the easiest way to do this is to give us a follow on Instagram at Damn Parenting Podcast and to rate us with 5 stars on the platform that you're listening to this. We hope you know you're not alone on this parenting journey and you enjoy the following episode. Let's get started.
Hi, and welcome back to another episode of Damn Parenting, your English-speaking parenting podcast from Amsterdam, the Netherlands. As always, we are your hosts, Eva and
Maren.
And we are back with a second session for our maternal mental health series. And today we are actually privileged to be joined by Professor of Hospital Psychiatry. Can you pronounce your name properly before I make a mistake?
In Dutch it's Birit, but Birit, Broekman, yes.
Thank you so much for joining us. We did want to talk about this as it's quite a crucial element and it's addressed by our verloskundiges here. About 2 in 10 pregnant women and maternity women has a psychiatric condition such as depressive symptoms or panic or postpartum psychosis. Very rarely that element. But OLVK has one of the target groups and the POP-poli has experts from psychiatry, OBGYN and Pediatrics as well to be able to collaborate. Here we're going to be able to find out a lot more about what they offer. So first off, hi and welcome.
Yeah, thank you very much for inviting me.
Would you like to introduce yourself?
Yes, well, I think you said it correctly. I'm working as a psychiatrist in the POP team. So that's the team that you just explained about to help women with psychiatric vulnerabilities who become pregnant or are interested to become pregnant. And I do also research in that area. And that's one of my interests.
Can you actually define what the POP because it sounds so funny to some of us where it's like, oh, the POP-poli, and we're like, I don't know what this is.
What is it? Yeah, it's the POP stands for Psychiatry, Obstetricians and Pediatrician Clinic. So we make use of the 3 specialisms and we think it's important to combine those perspectives from the 3 specialisms to get the best advices for someone who's pregnant and has also mental health problems.
So you work as a team?
We work as a team and we also give an integrated advice from the different perspectives. So if, for example, as a psychiatrist, I advise some medicines, it's of course important what is the impact for the unborn child or the child later on. So the neurodevelopment of the child. So the pediatrician will explain about that part because he's of course the expert in that sense. And the obstetrician is also there because when you have mental health problems during pregnancy, it can also impact on the pregnancy and maybe also on risk or obstetric risks that we should explain and should advise on. So we do that together in an integrated care model. And we see the patient also with the 3 of us.
So just to clarify who is actually coming to you, this can be someone who already is diagnosed with some mental health issues and now wants to become pregnant or is pregnant and now needs to be under care with their medication, or also someone who does develop symptoms of any mental health issues during their pregnancy, then both of these people would be coming to you then?
Yes, it's both. So first of all, it's important to realize that mental health problems are very common. So around pregnancy, we see that 1 out of 5 women experience depression or anxiety, for example, that are the most common mental problems. So if people experience that, it's important to know that it is, and you're not alone. It's a lot of people that suffer from this. Some suffer from those problems already before they get pregnant, and they are, for example, on antidepressants, and they may wonder if they can get pregnant with those medicines, or they are maybe having ADHD and use methylphenidate, those kind of medicines, and they have questions about it. Can I get pregnant with this medicine? What should I do? Is this the best medicine for me, but also for the baby? So that's the reason that this clinic is here, because we really look at the literature and update ourselves all the time from different perspectives to give the best advice at that point in time. But it's important to realize in OVG, we are an advisory clinic. So we are not taking the people into our treatment. We give advice to them and their psychologist, psychiatrist, or their GP, and advice on the medicine, for example, or on that they have to deliver, for example, in the hospital, or other advices that are important for that particular situation. So it's personalized care, of course. For every woman, it's different what we advise on.
And how do people get access to you? Do they go through the GP, or do they go first to you directly? How do we access this service?
Yeah, so sorry. So maybe to get back to your last question, that is one group, right? The other group is that they develop those symptoms That's also absolutely possible. And then they should also be referred, because then we can advise also on the treatment that is needed. They are referred by, depends, of course, if they have new symptoms, sometimes they go to the GP. The GP can refer, their own obstetrician can refer, the verloskundige in Dutch. And it is also possible that their psychologist or psychiatrist make a referral. So it depends a little bit on their history and where they are in care. I think that they all can refer to the POP clinic.
You mentioned there that you're with the OVG, so that's in Amsterdam. For those of our listeners who are actually around the Netherlands, can you actually let us know, are POP-polis like common in all areas of the Netherlands?
Yes, they are common in all areas of the Netherlands, but they do have different signatures. So some do only give advices like we do, with 3 different specialists at one table with the patient and the partner, if possible. But there are also clinics that do a first appointment with only a psychiatrist or only an obstetrician, and then they bring the case into a multidisciplinary consultation, sometimes without the patient, and then get the advice back to the patient. That's also possible. So there are different models, and some clinics also do really treatment in the hospital. So that's also possible. They take over the treatment for a while. So there are different signatures of POP clinics around the Netherlands.
Really good to know that there actually is a difference. So there could be more offerings in different hospitals. So
if I can make one more remark, what is also good to realize, I think most clinics do that as well, but we do also those preconceptional consultations. So it's important to tell that, because I think what I just said, some women may wonder, like, can I get pregnant with this? It's more important to come as early as possible, so we can give good prevention, so we can give good advice before you get pregnant. That's the most important. So you get into your pregnancy as stable as possible from our perspectives.
Speaking of that, what would be the common mental health challenges that mothers could experience in pregnancy itself, or even giving birth?
Well, the most common mental problem is depression and anxiety, but depression is common and has some impact on, of course, how you experience, I think, your pregnancy, but also we know that if there's a lot of stress, this may impact on the gestational age, the growth of the baby, but also if they are born a little bit earlier. And what we see, of course, after birth is that there is a risk that the mother, if they are very depressed, it's very hard to give a lot of attention to a baby, because you're also occupied with your own emotions. So it's hard to read your baby, to get a bonding with your baby. And that's impact in the end on the relationship with your child, but also on the neurodevelopment of the child. So a lot of studies that show that if the mother is really depressed for a long time, that may impact, unfortunately, on the child as well. Socio-emotionally, for example, or cognitive development, those kind of changes. They can be mild though, and they can also get better. But the most important thing to realize is that if you get early help, the earlier the better. That will absolutely also have a positive effect on all those effects that I just mentioned on. Yeah.
Can we discuss any of the screening or assessment protocols that you use to identify postpartum mental health issues?
We see most women already before they deliver, so it's more the antenatal mental health problems that we are focusing on in the POP clinics. We follow them up until 6 weeks postpartum. And what we use often are screeners that are worldwide used. Common screeners are like questionnaires. I'm not sure if you are familiar with it, but the EPDS, the Annenberg Postnatal Depression Scale, can also be used prenatally. That's one that we use. But also some questionnaires on the bonding with the child, for example. But most importantly, I think, is that we have psychiatrists on board. So there's also a psychiatric evaluation of the problems.
So you spoke about women can come to you prior to conception. They're with you also during pregnancy. And how long would they be with you postpartum if they will be under your care?
Not that long. So in the hospital, we feel we are specialized in the combination of the pregnancy, which is of course something that happens to your body, right, and the mind. But after giving birth, most of the women are somatically, as we say it, like the body is healthy, but they may experience still some mental issues. So then we refer them back. They normally have already someone during that whole period, because we are an advisory clinic. So they have another main caregiver. It's a psychiatrist or psychologist that refer them back to them. So we see them for the last time 6 weeks after birth. What we do provide is what we call klinisch kraambed. It's an admission in the hospital for minimal 12 hours, sometimes 24 hours, depending on the medicines that the woman is using, to also check the child. So the pediatrician is then on board. And if needed, we now also can offer in OLVG a possibility to stay a little bit longer if there are a lot of mental health insecurities or problems, to get a little bit more stable before going home, if that is also wished for by the patient.
You mentioned there that part of it would be you will refer them back to their therapist. What if they didn't have a therapist and this came on in pregnancy, and so they were only under your care?
Yeah, that we also do see that, but we do advise on. We have a good network in the city. I have to say, for example, GGZ Arkin is one of the largest GGZ institutions in Amsterdam. They're offering a lot of options for pregnant women with mental health problems, like a daycare or group treatments. We also work with other GGZ care, and we do also have a good network of psychiatrists in the city that work by themselves, but have their own clinics in vrij gevestigd, ZZP kind of, so they have their own business, but there are a few of them are specialized also in this area. And there's also a large psychology team, Psyche and Pregnancy it's called, Psyche en Zwangerschap. They also do have a lot of also English-speaking psychologists on board that can provide treatment. So we give them advices where to go to, and we give the GP also advices for the referral to certain possibilities in that sense.
Obviously, a lot of people out there, when we asked to get a referral for the GGZ for a therapist, there's always long waiting lists. I'm just wondering, how long might they be here? Would it be the same for specific the POP-poli?
It is a problem, but the ones I just mentioned do focus on pregnant women. And of course, they are at one point in time also not pregnant anymore. So they have a higher turnover, I would say. So there is some possibility, especially also Arkin is offering those, what I said, daycares and group treatment. That is really actually always possible. They have always place for these women, and also they offer sometimes an earlier acceptance of the patient because of this urgent matter of pregnancy. So you can't wait actually in this case. So they realize that as well. So there are some possibilities. It's not always easy, but there's attention for this here in Amsterdam at least.
And with the more and more, luckily, awareness of all these mental health issues, have you also seen that you actually have more women come in earlier or more aware or more informed about these issues over the last couple of years, especially also social media and all these things? Like mental health has really become, especially within the mother community, I feel, and this is also why we're doing this podcast, it's been discussed more and people are getting more aware. Do you also really see this in an increase of numbers or increase in interest in this topic? Or is it just we think that it's more aware in people, but actually you see, all right, it's been the same over the last 20 years. But can you say a little bit about that?
I think the awareness is better, but I have to say that it's not yet enough. So if you look at the numbers in OVG, we see about 400 women each year. They also do have a POP clinic in Amsterdam, UMC. So together we do see a part of Amsterdam. But if you look at the numbers, so how many women will suffer from those kind of issues, we definitely do not see them all. And we are also still a little bit concerned about that, because we know that if you give a very good start at the beginning of life, which actually starts preconceptionally, being healthy before you get pregnant, but even in pregnancy, it's a very important time. You can give a better start to your to the next generation, to your baby. And so that's really important. And it's all about prevention. So I think we should have more attention for this and bring more awareness and hope that more women come to the clinic earlier, I would say.
So we discussed how the POP means psychiatry, obstetrician, and pediatrics, and what kind of resources and treatments are actually being provided.
So what we do have in our POP clinics that we work together with the infant mental health that are specialists in the area of attachment with the child. So they are experts in the bonding with the baby, but also how you can read your baby, which is really essential for a healthy development of the child. And we believe, or we know, that this already starts in pregnancy, the bonding with your unborn baby. So what we do now is we actually brought those specialists that are working in the city, an ambulatory team. We bring them into the hospital next to our clinic, so in a room next to the POP clinic, and we make it part of the POP procedure. So we tell the women, like, after the clinic, you also will see some of the specialists of the IMH, which we work together with, and they have a kind of introduction in what they can offer them, and they meet already this kind of person, which makes it more easy and less scary, I think, and more informal to get this help. So before we had to refer them, and they felt like, wow, infant mental health, do they think I cannot be a good mother or I cannot relate to my child? I think that was a kind of barrier, and now we see that they accept it very well, and more of those women are also coming into treatments with IMH, and I think that is a big step forward. So that is one of the things we offer. The other things we offer is, of course, we look at the medicines, if there are medicines taken, or we may advise on starting medicines if needed. We advise on psychotherapy. For example, if there's trauma, it may be useful to already get trauma therapy before the child is born. It maybe sounds strange, but it may help you also, again, in the bonding later on. And EMDR, which is one of the good treatments for trauma, is possible in pregnancy. This has been researched by one of our gynecologists here in LFG. And we offer also, from the pediatrician, will, what I said, after birth, check the child, but also may make new appointments if needed with the mother and the child. And we also think of extra help if needed from their perspective. So yeah, really an integrated care plan.
It's quite nice to hear that that the system here is really moving towards, as you say, like even preconception, and it's really integrating every aspect and including every person. And I've never heard of the infant mental. Yeah, I mean, that's actually incredible.
It really feels like, just you explaining this whole field to me, it really feels like it's a safe haven and you are in good hands, and it's like everyone is working together to really make this a good experience. And everyone who is already going through mental health issues and might feel guilty even, or might feel what a shame or whatever, that is really, there is a whole team looking on all these different angles, also on your baby, because they all have the best interest, which is your well-being, the well-being of your child. And no one is alone in this, and no one should be scared of going through that process. No one is stigmatized. Or also, when you talk about medication, if someone is on medication, that they get really good advice also with then breastfeeding and all that, and that mental health issues are not viewed as an not overcome obstacle, but is something that we can work with the right people in place, with the right systems in place, and with the right medication. And I think that is the most important message, that there is a place where you're not judged, where you're not shamed, but you are welcomed. Everything is brought to the table, and there's someone looking at it with a holistic view. How can we make this a good experience for everyone?
Yeah, absolutely. We try our best to do that. And I agree with you that it's really important. It's not stigmatizing. I think we really do not do that. Also, when we give our advices, we do that in shared decision making. And sometimes a woman will decide not to follow our advice. We always say, please come back. We will not be angry about that, right? It's your decisions. Of course, it's important to follow your own heart always. But let us explain things, right? Let us explain what we know from evidence, from scientific evidence, and see how you can weight that for your own situation the best, for you and for the baby. And that that's what we really try. To give really a good start to all women and their babies and their families, of course, the best as possible. Yeah, absolutely. And maybe it's good to mention also, I think we are pretty proud on that, is that we also work together with patients. So also ex-patients, call it also experts by experience. So for Mind, for example, Mind is a large organization in the Netherlands, patients of mental health. And we work together also in research with one of those expert by experience. And she made a nice book, because you just said something about feeling guilty. We see that often a problem that women are suffering from. And she made a book with all the experience of patients that we have interviewed and in focus groups. And it can be helpful to read that, because you feel not so lonely. There are all kinds of faults you may have, and a lot of women have those faults. So it can be helpful to read that kind of book. You can find it, I think, by the Mind website.
When we walk into the POP-poli, is it like going into a very white, everyone's dressed up and you're kind of like, oh God, I'm bringing them into a clinic?
Yeah, I think we can do better on that part. So what we always say, don't be shocked when you start coming to the room, because we are 3 specialists there, right? And we are wearing those white doctor's jackets. So I can imagine that it may feel like, wow, what's going to happen? But I have to say, I think most of our women go away and are very relieved and happy with the advices we give, because what I said, we do it really by providing information and not pushing to any decision. Also, they may come for preconceptional advice, and we have sometimes the question, do you think I can become a good mother? We never will say like, you cannot become a good mother, or you should not take a child, right? That's not what we will decide on. It's that we can't. So we just provide information. This may be the risk. This is what you can do. This is how you can get a better start for the baby and for yourself. And then, they can weigh that again for their own situation. So, I think if you come in the room, you may think like, what is going to happen? But I think the experience overall, and we evaluate the experience, are pretty good. So I think, I hope people get not scared by this idea. It should be something that you just use for your own benefit. But that's what we are for.
I can just imagine if you only have like a couple of day old baby and you're turning up maybe, and it's just a case of, oh God, this is so clinical and it's such a shutdown, that it's just nice to know, hey, yes, it is a clinical, but it is because it is in a clinical setting and we're here just to support you. So don't be turned off. This is.
Yeah, absolutely.
We just want to say thank you so much for joining us. You are really crucial to this conversation we're having for our maternal mental health series. It's amazing, POP-poli, to only learn about that obviously in pregnancy, to be honest. We didn't know anything of it ourselves. It's an extraordinary amount of effort you guys are going through. And as you say, you do research as well. So it's continuous change and developments, and hopefully reducing any impact of any issues or struggles that some moms might be going through. Greatly appreciate your time. We appreciate your work that you're also doing as well. Thank you again for joining us on Damn Parenting.
Thank you very much for this opportunity and for bringing this out, because it's really important. And thanks for that.